Dorset, in common with most areas of the country, I think, has got dermatology services which are really under pressure. We don't necessarily have enough staff. We've got a lot of demand for the service. And we found that a lot of the referrals that were going into our already stretched dermatology services really didn't necessarily need to be there. So actually, we needed to find a way to deal with that, really, and teledermatology was a good way to actually filter through the referrals that were going through and actually make sure that the ones that were going in were the right ones.
If I've been seeing a patient with a rash, I'll usually try something myself. And if that hasn't worked and I need to ask somebody for advice, I'll use my Consultant Connect app. I take a photograph of the lesion, then you send it off. The advantage of Consultant Connect is that it's an all-in-one. Before taking a photograph, having it printed out, the consent process, there needs to be somewhere to store the consent. All of that would prevent you from using that in a busy clinic. Consultant Connect enables me to do everything all in one.
Teledermatology isn't new. It's been going on for years, but it's been very ad hoc. Usually a GP will be emailing in a photo with a bit of advice required, and it's then a sort of a response as and when. But really we're taking that beyond that now, formalising it, and that's really strengthened the service. So we now do that through the e-referrals system that's a proper NHS service. The beauty of that system is that we've got one system that we can go in and respond, and it's an instantaneous response back to the GP. We can see the photo that's attached. And then the other thing about that system is it allows for a conversation. So we can give some advice, but it gives the opportunity for the GP to come back and to ask a bit more. We can start to not only talk about the diagnosis, but the way we're going to start to manage that patient, where they should be referred to. If they do need to be referred, what sorts of treatments we can start even before seeing the patient.
The Consultant Connect app has been really helpful for us. Previously, if we wanted to discuss a patient with a skin problem, we would either have to try and describe the lesion with words, which is very difficult, or take a photograph with our own personal cameras, which really isn't appropriate for clinical photography.
It does mean that we can prioritise those patients that need to have secondary care. We can spend more time seeing those patients in clinic, and those that can be dealt with through the advice and guidance system can be managed then by their GP. What advice and guidance is also very good for is for us to be able to directly list potential skin cancers that need to have surgery under local anaesthetic. So if a GP is able to send in a photograph of perhaps something like a basal cell carcinoma and the patient is willing to be seen straight in theatre for excision of that lesion, then we can direct list them, which means we cut out an initial outpatient appointment, so speeds up the patient pathway.
From a CCG point of view, in terms of investment, it's been a really worthwhile exercise. We introduced Consultant Connect in September 2018, last year. So far, we've got over 90% of GP practices signed up to it. We've had about 4,500 photographs sent through. And what we're finding is that about 60% of the ones that come through teledermatology don't actually convert to a referral into dermatology services, which is quite a significant number. Teledermatology fits very well into the longer term plans of the NHS, I think. We're all being encouraged to use technology. This is a really good, easy way. You know, it's been actually very straightforward, very easy to roll out across Dorset. Our GPs are very supportive of it. Patients are very happy with it. It's good sometimes as well to start with things that are more straightforward, which can be embedded fairly quickly and easily, because then you build on that success. So it's been a really good thing to do. It absolutely fits with the plans. It absolutely fits with using more technology, reducing outpatient appointments. So to me, it fits very, very nicely.